Mine companies in South Africa are ready to compensate and treat all ex-mine workers who are suffering from TB. This was revealed by the Minister for Health in South Africa during the discussion of TB in mines at the ongoing SADC Ministers for Health meeting, which was held at the Royal Swazi Spa Convention Centre.
When the SADC health ministers arrived in the kingdom on Wednesday, ministers from the E8 countries, which are countries who are fighting together malaria, had a meeting where they were looking at the 2016 annual report and programs they will be initiating next year. That meeting was followed by a gala dinner hosted by the South African Chamber of Mines, where the main issue was TB in the mines. South African Minister for Health Aaron Motswaledi said TB is the greatest killer of all time. In 2014 alone, TB killed 1.8 million people. He said that there are 2.7 million people in Africa who are suffering from TB. The Chamber of Mines said they are looking for all ex-miners in all the SADC countries for screening to ascertain whether they have TB or not. If they do, they will be taken for treatment. The ex-miners will also be compensated for their monies waiting for them. Thursday was indeed the climax of the SADC meeting for health ministers. They met and looked at all the recommendations done by the meeting of senior officials from Monday to Wednesday. We spoke to the Director of Health Services in the Ministry of Health in the Kingdom of Swaziland, Dr. Makakula, who explained on some of the issues that were discussed by the ministers.
One of the major issues that have taken place that has been talked about and which took some time for the time of the ministers as they were discussing were the issues of training and the availability of professionals, particularly doctors and specialists. And it actually came into light that some countries, some member states like Mauritius, they do have an excess of doctors, excess in the sense that they have produced more than they can use at the moment. And it came out clear that such negotiations need to be encouraged between the governments so that such is avoided, that individual patients may be going to seek treatment elsewhere without their respective governments knowing each other.
By the time of compiling this report, the ministers were busy in their meeting room having those serious debates, and later they were expected to give out a communique on some of the decisions they took. For Swazi TV News, I'm Linton Gule with Smuva Shongwe at the Convention Center, Ezulwini.